Stem cells. There's an exciting phrase in medical science today which represents a whole new area of treatment which has been previously unavailable to us. But what are stem cells? Remember, we all come from that one little tiny microscopic dot called the fertilized egg. From that little tiny structure, that egg divides, redivides, and divides again until a small embryo is formed. The embryo, of course, grows until it becomes another human being. Amazing, amazing to think about where it started from. Part of that development from that single cell is the fact that some of those cells retain their basic ability to differentiate and form all other types of cells sometime in the future. Those are called stem cells. We have stem cells in our body, and they continue the same function. Stem cells function to help provide new tissues, heal and repair, but a certain number of them also regenerate to become newer stem cells. This whole process takes place in the bone marrow of our bones, and many of the stem cells are stored in our fatty tissue. A number of years back, medical science learned how to use these stem cells for various forms of treatment. We have the most experience in the musculoskeletal area, in that we can inject stem cells into various joints, tendons, and ligaments, which do an amazing job of regenerating tissue that's either been worn, damaged, or no longer functioning properly. This process over the years has been shown to be able to help many people avoid more extensive surgical procedures, improve their mobility, diminish their pain. However, stem cells are also being explored in many other areas, just about every area in the body. There are areas in which stem cells are used to improve COPD, that is to say, emphysema. There are areas in which stem cells are being used to regenerate new organs, to improve metabolic problems in our body, and yes, even stem cells to improve brain and neurological function. Most important, most amazing is two serious neurological problems: multiple sclerosis and amyotrophic lateral sclerosis, ALS. Both severe, progressive, terrible conditions, and even now there has been early research evidence, clinical response to stem cells in patients who have these conditions. Based on my 45 years plus of clinical experience and research, there are several important factors which must be the basis of any type of stem cell treatment. Number one, it's important to evaluate the underlying nutrition of the patient. Very often today we find that because of the world we live in, a lot of the synthetic and artificial supplements and foods that we eat, that our bodies do not have the optimal nutrition that they should have. This is an important factor because, remember, stem cells from your own body are stimulating your body to do the healing and repair. In order to do that successfully, your body must be in optimal health. Number two, we live in a very industrialized world, which means our environment carries with it many synthetic and many toxic materials. Over the years that we live here, our bodies accumulate a lot of these toxic and harmful materials. These things have a tremendous effect on causing abnormal inflammation, tissue deterioration, and diminishes our immune system. It's very important to evaluate the patient for these conditions and treat them if possible, all of which greatly improves the chances that they will have a very successful response to stem cells. Next, extracted cells should be processed and injected back into your body within several hours. There have been techniques of taking these cells and storing them, manipulating them, multiplying them, which are all considered nowadays to be both unnecessary and potentially unsafe. And finally, the injection of the stem cells back into whether it's your knee, your hip, whatever the area is, should be under surgical type of conditions and also done under ultrasound guidance to be sure that the stem cells are properly injected into the appropriate places. Everybody's condition, of course, is different, so if you do have any questions, please do not hesitate. Call my office. Speak to me personally. We offer a free 15-minute consultation so that we can discuss your case and see if we can be of service to you. Thank you so much.